Hi, Belen. How are you? Good afternoon.
Hi, Misheel. Good afternoon. I'm fine, and you?
Fine, thank you. I'm just searching for our presentation.
Okay.
Are you going to your classes or you're on vacation or what are you doing now?
I already passed all my theoric schedules.
Okay.
I'm just waiting for my internship.
Oh, that's so good. So you're waiting for that.
Yes.
Okay. Hi, Vania and Ale. How are you?
Hello, Miss.
Hello. Good afternoon.
Good afternoon, Miss.
How is everything?
Hello, Miss.
Hey, hello, Ale. Okay, wait for Liliana, I think. Yes, just a minute, okay? And then we're gonna start. Did you have the chance to watch the book? Hello?
Not yet, Miss.
Okay, don't worry. But for the other classes, from now on, I can suggest that you can read maybe the book before we do this class, okay? In order to find out some words that you don't understand. And maybe we can talk about this, that each between us and just try to solve any problem we can have, okay? Okay, I think we can start. I will. Mm, 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 mm. Please tell me if you can see my screen.
Yes. Yes, teacher.
Okay, that's good. Okay, today we're gonna talk about another theme that is medical and paramedical personnel and places. This theme will help us to know more about the names that you usually will find when you work in a hospital, okay? You will find out the name of places you will find out in a hospital too. So if you have any question while I'm presenting these slides, please tell me, okay? Okay, we have this first slide. Belen, can you read this for me, please?
Okay. Medical practitioners 1. A doctor who treats patients as opposed to one who only does research is called clinician. A doctor who provides primary care for patients is known as general practitioner or family doctor, usually work in group practice. Larger group practices in building called a health center.
Perfect. This can be understood, or you have any question? I will repeat it, okay? A doctor who treats patients as you and I, right, is called a clinician. And we have another kind of doctors that are researching and investigations, okay? And those are research, only make research, okay? So you are clinicians. A doctor who provides primary care for patients is known as a general practitioner or family doctor. Is that we call on your clinics or hospitals? Is the same or you have another names?
I think it's the same about clinical doctors, you said, Miss?
I was referring to a family doctor or general practitioner or general doctor.
No, the family doctor is like another doctor. It's an specialist. Yes,
Specialist.
yes, yes. But a general practitioner could be a general doctor who has no specialism. I don't know how to say it.
Specialization.
A specialization. Okay.
Okay. What about you, Vania? Is the same for you? We know that primary care is like, who knows? Who can tell me what is a primary care?
The primary care.
Mm-hmm.
Yes, is a responsibility for family doctors, or could be general doctors too.
Okay, so you
They
are
are,
agree.
yeah,
Okay,
yes,
so
yes.
in Spanish, what is the name of primary care?
Son los cuidados en general que
Uh,
se
y-
realizan a los pacientes.
yeah, but it has a specific name, and it's atención primaria.
Atención
Primary.
primaria.
Okay, so don't worry. I know that maybe some definitions are a little bit confusing, but I want you to know in in the easiest way. Okay, so if we know that this is a primary care for patients, and we know that in some cases, general practitioners has the chance to attend these patients, or in other hand, we have a family doctor that I don't know. And if I'm wrong, please correct myself, okay? Tell me, can attend to children and mother and children, I don't know. Maybe that's a family doctor.
Yes, family doctors treat patients in general, and when it's something specific, they go and send you to nephrology, neurology, and that things. But the family doctor is who receive all the patients that have primary cases or things that were not very difficult to solve.
Okay, so in conclusion, a general practitioner could be or slash family doctor too. It's okay, we agree with that.
Family doctors have a specialty, a specialization. Family doctor.
Yeah, it's an
General,
specialization here.
yes, yes. And general practitioner don't have a
An
specialization.
specialization. Okay, but both of them work attending primary care.
Yes.
Okay. Okay, so that will be the conclusion. One of them doesn't have an specialization, okay? And the other one, yes. And both of them provides primary care, okay? Ale, are you there?
Yes, Miss.
Okay. Do you understand the main point?
Yes.
Perfect. If you disagree with something, you can tell me, okay? And we can talk more about this. Okay, so here we have specialties. Ale, can you read this, please?
Of course. Specialties doctors, for example, pediatricians, generally work in hospitals who work outside the NHS, providing private health care, may have consulting Zooms outside a hospital.
Okay, thank you. So specialties, doctors, that will be the doctors who has specialties or an specialization. For example, pediatricians generally work in hospitals, right? Who work outside the NHS, that will be a national health service. If you want to write down on your notebooks, providing private health care, may have consulting rooms outside a hospital. Do you understand the main point of this paragraph?
Yes, Miss.
Okay, some of them, the one who has specialties, work at hospitals, right? As the NHS. What was the NHS?
National Health Service.
Perfect. Thank you. And those one provides private health care too. So they have a private consultations outside the hospital. Perfect. Vania, can you read this, please?
Okay. The two main branches of medicine are surgery and internal medicine, and the doctors who practice these branches are called surgeons or physicians, respectively.
Physicians.
Physicians. The box me?
Yeah, please.
Okay, a cardiologist, a geriatrician, anesthetist, specializes in, is a specialist in, okay. A cardiologist, specialist in disease of the heart and circulation or cardiology. A geriatrician is a specialist in disease of elderly patients of geriatrics. An anesthetist is a specialist in anesthetics. Note, names of specialists usually end in ology. Names of specialists usually in ologists. If the name of specialist ends in EIS, the name of the specialist ends in Asian. There are some expressions, AJ anesthesists and anesthetists. Well,
Thank you, don't worry.
Pronunciation.
I know
okay.
this can be like a puzzle, right? Okay, so the two main branches of medicine are surgery and internal medicine. You are a doctor from internal medicine, right, Vania?
Not yet, Miss, but I
But
want.
you want. Yeah,
I want.
Okay, and the doctor, and I know that Belen wanted to be a surgeon. That's right?
That's right, a pet surgeon.
Pediatrician surgeon, right?
Right.
Okay. And Ale, what did you say to me? What it was your specialty? Or what do you want to specialize in?
Dermatology.
Yeah, I'm so sorry, I forgot. Okay, so, and the doctors who practice these branches are called surgeons and physicians, respectively. Okay, so who are specialists in surgery will be surgeons, and who will specialize in internal medicine will be physicians. Okay, as a cardiologist will be specializes in diseases of the heart and circulation or cardiology. A geriatrician is a specialist in diseases of elderly patients or geriatrics. And anesthetist, I'm sorry, is a specialist in anesthetics. Okay? I want you to notice that here there is a little difference, okay? And it will be like a puzzle for us to make a pronunciation, right? I don't know if you have some trouble with vocabulary here or it's perfectly understood till here.
It's fine.
Okay.
It's okay.
Okay, perfect. And the note we have to take in our minds. Names of specialties usually end in ology, right? Like cardiology, okay? Names of specialists usually end in ologist. I want you to notice that specialties and specialists are different. Specialties are cardiologists, surgery, dermatology, right? And the specialist is the person who is gonna treat in these specialties, okay? So usually ends, I'm so sorry, I ate a D here, and in ologist. If the name of a specialty ends in IES, the name of the specialist ends in Asian, okay? There are some exceptions, like anesthetics and anesthetists, okay? That was the little bit difference I want you to notice. This part, I don't know if you understood this part. I know it can be a little bit difficult at first, but I want you to notice the difference, okay? So, did you understand?
Yes, Miss.
Yes.
Okay. What about you, Vania? Is okay?
Yes, Miss.
Okay. Okay, we have here choosing specialty. And we have a box. I don't know who can read this, please, for me. Anyone? Okay, I'm gonna do it. Or Belen, I don't know if you wanna do it.
It's okay. No one says nothing, so I was going to read that. You can read it, Miss.
I would rather if you read it, please.
Okay. Choosing a specialty. Jill Matthews has just graduated from medical school and is thinking about her future. I haven't decided what to specialize in yet. I need more experience before I decide, but I'm quite attracted to the idea of pediatrics because I like working with children. I would certainly prefer to work with children than, say, elderly patients. So I don't fancy geriatrics. I was never very interested in detailed anatomy. So the surgical specialties like neurosurgery don't really appeal. You have to be good with your hands, which I don't think it's a problem for me. I have assisted at operations several times, and I have been done some minor ops by myself. But surgeons have to be able to do the same thing again and again without getting bored, like trying off cut arteries and so on. I don't think that would be a problem for me, but they need to make decisions fast, and I'm not too good at that. I like to have time to think, which means surgery is probably not right for me. Note, the collocation good with is followed by a noun. He's good with children. The collocation good at is followed by the ing form, the gerund of a verb by a noun. She's good at explaining procedures. She's good at explanation.
Thank you. And that could be your story, right? Okay. So we're gonna read it again. I want you to tell me if you find out a word you don't understand, okay? The main I want you to read each one of you, those boxes or the slides in order to improve your pronunciation, okay? So it would be better if you try it. Okay, Jill Matthews has just graduated from medical school and is talking about her future. I haven't decided what to specialize in yet. I need more experience before I decide. I don't know if it happens to you, guys. Do you feel that is needed more experience before you decided what you're gonna specialize in? Vania?
I think yes, miss, because the specialist, the specialist is very important.
Okay, but do you think you need more time to before you do your specialization, or you think it's time you just finished your medical school and you have to do your specialization?
Uh, okay, when you finish the medical school, because
You will
the,
forget.
the specialty is long too.
Okay. Okay, that's good. I need more experience before I decide, but I'm quite attracted to the idea of pediatrics because I like working with children. I'd certainly prefer to work with children than, say, elderly patients. Do you understand this word, elderly patients, or this expression?
Yes.
Okay, so I don't fancy geriatrics. I was never very interested in detailed anatomy. So the surgical specialties like neurosurgery don't really appeal. You have to be good with your hands, which I don't think is a problem for me. I've assisted at operations several times, and I've even done some minor ops by myself. Do you understand this little word here?
Yes.
Yes.
Okay. But surgeons have to be able to do the same thing again and again without getting bored, like trying off cut arteries and so on. I don't think that would be a problem for me, but they need to make decisions fast, and I'm not too good at that. I like to have time to think, which means surgery is probably not right for me. Okay, our little note. I don't know if you want to write down on your notebooks, please. The collocation good with or the expression good with is followed by a noun. He is good with children, right? The collocation or the expression good at is followed by the ing form gerund. What it means, gerund? It means that we are using ing at the end of the verb, okay? That is a gerund form of a verb, or by a noun. She's good at explaining procedures. She's good at explanations. You can use both, okay? Do you have any questions still here?
No.
Okay, so that's perfectly understood. Okay, we have the hospital staff, the people who work in any type of workplace, including hospitals, are called the staff, okay? A pre-registration house officer, you will put in these letters, PRHO, or house officer is a newly graduated doctor in the first year of postgraduate training. After a year, he or she becomes a registered medical practitioner in the current system of training. The foundation program, the name for this junior doctor is Foundation Year 1 Doctor. Do you understand more or less what a foundation year is? Do you have any idea?
It's like the residency.
Yeah, it's like that. Okay, this book we are using is from UK. So if you want to go there, this will help you a lot. Okay. The foundation year for one is a FY1 and is like a residency. Residente 1, Residente 2, Residente 3, right? And the foundation program is Programa de Residencia. Do you have any questions here?
I have a question.
Okay.
The PRHO is like he's on the first year, right, of foundation?
Yeah.
And the second year, how can you call it? Like foundation year 2 or?
No. A foundation year, 1 doctor, FY1, is the first one of residency, right? It would be a synonym, more or less. The second will be a foundation year 2 doctor. And I think it's till 4, maybe.
Yes, it depends on the specialty you choose.
Okay, so it works like that, okay? But remember, a pre-registration house officer or house officer is a newly graduated doctor in the first year of postgraduate training. After a year, he or she becomes a registered medical practitioner in the current system of training. The foundation program, the name for this junior doctor is Foundation Year 1. So it would be almost a synonym for a house officer. Okay?
Okay.
Okay. Ale, do you have any questions here?
No, miss.
Okay. Ale, can you read this, please?
Yes. A senior house officer, SHO, is in the second year of postgraduate training. The title is now Foundation Year 2 Doctor, but the old terms Senior House Officer and SHO are still used.
Thank you. So here we have the answer for your question, Belen. A senior house officer, SHO, is in the second year of postgraduate training. The title is now Foundation Year 2 Doctor, FY2. But the old terms senior house officer and SHO are still used. So it can be used both, okay? But with the only difference that here is senior. Is understood, guys?
Yes, Miss.
Perfect. Vania, do you have any questions?
No, miss.
I know it's a little bit confusing here, but I know too that you're gonna have the idea, maybe if you go outside of the country. Okay. Vania, can you read this, please?
A specialist register is a doctor who has completed the foundation program and is training in one of the medical specialties. These are also some non-training registrars, doctors who have completed their training but don't wish to specialize yet.
Thank you. So, a specialist registrar, SPR, is a doctor who has completed the foundation program and is training in one of the medical specialties. These are also some non-training registrars, doctors who have completed their training but do not wish to specialize yet. Okay? A specialist registrar. Belen, can you read this one, please?
Okay. A consultant is a fully qualified specialist. There may also be some associate specialists, senior doctors who do not wish to become consultants. In addition, there is at least one medical or clinical director who is responsible for all of the medical staff.
Okay, thank you. Then we have a consultant is a fully qualified specialist. There may also be some associate specialists, senior doctors who do not wish to become consultants. In addition, there is at least one medical or clinical director who is responsible for all the medical staff. Okay? I don't know if you have some doubt about vocabulary here.
Teacher, what's the meaning of list?
Where is at least here?
Yes.
there is at least one medical, que existe al menos un doctor, ¿ok? Al menos, at least. So we're good here?
Yes.
Yes, Miss.
Perfect. I will read this one, okay? Try to follow while I'm reading, please. Medical teams. Consultant physicians and surgeons are responsible for a specific number of patients in the hospital. Each consultant has a team of junior doctors to help care for those patients. In many hospitals, there are multidisciplinary teams which consist not only of doctors, but also of physiotherapists and other allied health professionals. Okay? When patients enter or are admitted to hospital, they are usually seen first by one of the junior doctors on the ward, where they will receive treatment and care. The junior doctor collects them, take their medical history, and examines them. Sometime later, the registrar also sees the patients and may order investigations or tests, for example, X-rays or an ECG, make a provisional diagnosis, and begin treatment. The consultant usually sees the new admissions, people who have recently been admitted to the ward for the first time on one of the regular ward rounds. When the management of the patients is discussed with the registrar, consultants also decide when a patient is ready to be discharged or sent home on the ward round. The consultant is accompanied by the team and a nurse, and they visit all the patients in the consultant's care. Do you have any doubts about vocabulary here?
No.
Okay. What about Vania and Ale?
Words means ward,
Ward.
and clerks.
Okay. Clerk would be like the person who helps you writing down, checking on the computer. You're maybe telling something and she will help you to do that. Will be your almost your secretary. Okay, that is a clerk. And a ward, in this case, it would be una sala o una guardia. Is this clear?
Yes, miss, thanks.
No problem. What else?
Miss, what is a registrar?
Where are you? Where is it, Ale?
The registrar also sees the patients.
Oh, here we have. Here we have. A specialist registrar is a doctor who has completed the foundation program and is training in one of the medical specialties. Okay, These are also some non-trainer registrars, doctors who have completed the training but do not wish to specialize yet. So it will be almost like a general practitioner. What we call here like a general practitioner. Am I wrong? Maybe Belen?
No, yes, it's
It's
like you said.
it's almost a general practitioner, right? Because they don't want to do their specialization yet. So they will help on the consultation when a patient arrives. This will be the first one who will receive the patient. Okay? Is it understand?
Yes, Miss, thanks.
No problem, Ale. Anything else? Or that is clear?
It's okay, Miss.
Okay. Do you understand these letters? ECG?
Yes, we write the same in Spanish.
Oh, I'm sorry.
No, it's fine.
So that's so good. Okay, let's talk about this. Vania, can you read this one, please?
Yes. Shifts. Junior doctors now normally work in shifts, which means they normally work for 8 hours every day. For example, 7 a.m. to 3 p.m. and are then free until 7 a.m. the next day. After a week, they change to a different shift. For example, 3 p.m. to 11 p.m. or 11 p.m. to 7 a.m. The alternative system is to work from 9 a.m. to 5 p.m. Every day and to take turns to be on call, available to return to the hospital if necessary from 5 p.m. to 9 a.m. the next day. Days on call are set out in a route or list of
It's okay.
names and times. Doctors on call carry a radio pager or
Pager.
pager or bleeper, a device which makes noise when someone is trying to contact them.
Thank you very much. First of all, I'm so sorry. It was 8 hours here, okay? And I don't know where else I made a mistake here. But I want you to understand what a shift is. Do you get the idea?
Yes.
Okay, what about you, Ale?
Yes, Miss.
Perfect. And Vanya?
Yes, miss.
Okay. A rota, this is a word that usually is being used in UK. Okay, it means a rotating schedule. Okay, and you know those artifacts, right? A bleeper or a pager, a radio pager that will make some noises in order to tell doctors that they are been looking for a consultation, right?
Right.
Okay. So we have the nurses. Nurses' grades working in a hospital have the following grades. Student nurse, a nurse who is still in training. The staff nurse, a nurse who has completed the training course. And charge nurse, a more experienced nurse who is in charge of or responsible for a ward or department. Nurse manager, a nurse who is in charge of several wards. Note, the old sister is still sometimes used for a female charge nurse. A female nurse manager may be called matron. Well, here a matron. What does it mean, a matron? Do you know? I think you use that term too.
The assistant pregnant.
Yeah,
Could be.
that is a matron here, right? But in UK, for example, a female nurse manager may be called matron. But that's right, Vania, thank you. So I don't know if you have any questions here.
No, miss.
Okay. Support workers. The clinical support worker who has done a short course and obtained basic qualifications, and the nursing auxiliary who is usually unqualified, both assist nursing staff. There may also be ward clerics whose duties include making sure patients' notes and information are up to date and answering the telephone. What I was telling you, as a clerk, they do as a secretary work, right? And they are trying to help the other people on this staff. Is it understood?
Yes.
Okay,
Yes,
what
miss.
about? Okay, thank you. Specialization. Like doctors, nurses can specialize. A midwife has specialized from the beginning by doing a course in midwifery, the management of pregnancy and children. Okay, that is a midwifery, the management of pregnancy and children. District nurses visit patients in their homes. Health visitors also work in the community, giving advice on the promotion of health and the prevention of illness. So, do you have any questions here?
No, miss.
Perfect. Um, mm, 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 mm.
Miss,
Yeah,
I don't understand. My midwife and midwifery.
midwifery is the
Midwifery.
management of pregnancy and children, but we have a specific word in Spanish. Do you get the idea? Or who's gonna tell me? It's like a partera.
I don't know if we can say like that to that specialty because las parteras, I don't know, sometimes they're not nurses. They're like a mix of matronas and las parteras que llamamos acá, ¿no?
Right. But remember that in this case, Here, most of our nurses doesn't have a specialization, right? But there, they have a specialization. And this book says that this is a specialization for them. And if you go to make a translation in your dictionary, you will find that it's like parteria or something like that. But it will be a homework for you for tomorrow, if you agree.
Yes, it will be interesting to read about it.
Yeah, okay. So we're gonna talk about this and we will get a conclusion, okay? So that will be our homework. The nurse's role. The nurse's role has changed considerably in recent years. In addition to general patient care, checking temperatures, pulse rates, and blood pressure, changing dressings, giving injections, and removing sutures, nurses now do some of the things previously reserved for doctors, such as prescribing drugs and ordering laboratory tests. More responsibility for nurses is planned, as the following article demonstrates. I don't know if you can read this, Belen, please.
Okay. Nurses carry out surgery in effort to cut patient waiting list. Nurses in Scotland trained to perform minor surgery have entered the operating theatre for the first time in an effort to cut patient waiting times. 5 nurses who have passed a new course at Glasgow Caledonian University are now qualified to carry out such procedures as the removal of small lesions, benign moles, and cysts or sites. I don't know how to pronounce cysts. Okay.
Yeah. Okay. Do you have any questions of vocabulary? For example, cysts are quistes. Okay.
Yes, Miss, these words, moles and cysts.
Moles. Moles are those black points on our skin, but well, lunares. Okay, and cysts are quistes. But do you agree with this? It's true, right? In some, I don't know if in your rural year, find out that nurses do so much work than doctors. What do you think?
I don't know. I didn't go to my rural yet.
Yet, okay, you will find out. I hope you get into a hospital or center where doctors do their job and nurses too. I went to a center where the auxiliary nurse was like the chief of the place, and the doctor just traveled a lot, and they really don't care about anything on the center. That's why I was telling you. I don't know what was your experience, Vanya, maybe.
Yes, in the rural year,
Mm-hmm.
there are little, a few personal health and auxiliar, nurses auxiliar, um, students work a lot. It's,
Okay.
it's a hard work.
Yeah, that's right. More if it's a big place, right? A hospital, for example. I don't
Yes.
know if you have any questions for vocabulary or it's okay here.
And Miss, previously reserved for doctors. I don't understand this
The
phrase.
okay, where is it, please?
In the third, yes, in this line.
Okay, giving injections and removing sutures. Nurses now do some of the things previously reserved for doctors. It means that doctors used to do those things, right? That before it wasn't allowed to nurses, but now nurses can do this. Okay, so
It's
previously
a,
reserved. Do you understand now the main idea?
yes, it's a indication doctors. It's
In Spanish, maybe it might be que estaban reservados anteriormente para los doctores.
okay.
Previously reserved, okay? Okay, the verbs perform and carry out are used with all types of procedures. They are often used in the passive form. Perform an examination or carry out an operation, a procedure, an experiment, a test, a biopsy. The procedures was performed by a nurse or carried out by a nurse. Do you understand these expressions?
Yes.
Yes.
Okay. And Vania?
Yes, Miss.
Perfect. We're gonna continue then. Allied health professionals, community health. The health of the community depends on a large number of people other than medical practitioners and nurses. These can be grouped under the heading of allied health professionals. They include the following. We have a physiotherapist here that can be an allied. Do you understand the word allied health professionals or the expression?
Yes.
Okay. Then we have the technicians. There are numerous technicians, people who work with scientific equipment, such radiographers, who are known as an X-ray technicians. Ambulance technicians work in the emergency service. An ambulance technician with more advanced qualifications is called a paramedic. Okay, so I think here we don't have a paramedic, right?
Like a career, not. But yes, we have courses and some, yeah, some courses.
Yeah, I think we don't have this like a career. Okay, but you understand the main idea. Those are technicians, an X-ray technician or a paramedic. Do you understand?
Yes.
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 Perfect. And we have the prosthetics or orthotists. Prosthetists and orthotists provide care for anyone who needs artificial limb. Do you remember what was a limb? Yesterday we were talking about that. It could be an upper limb or a lower limb. Remember?
Yes.
Okay. A prosthesis or a device to support or control part of the body, an orthosis. They also advise on rehabilitation, helping patients return to normal life and work after treatment. Prostheses provide artificial replacements for patients who have had an amputation or were born without a limb. Vania and Ale, do you remember what was a limb?
Yes, Miss. Es como miembro superior e inferior.
That's right. Okay. Do you have any questions here for vocabulary?
No, miss.
No.
Okay. Orthotists provide a range of splints and other devices to aid movement, correct deformity from an abdominal development of part of the body. For example, clubfoot, calipes, and relieve pain. I'm gonna talk about these splints. Splints are advices that you can put on a foot in order to limit the movement, but it's partial. Do you understand the idea?
Yes.
Okay. Belén, can you say it in Spanish for us, please?
Ok, es como son consejos para ayudarte a que no sea, o sea, que corrijas de una forma normal y que no molestes, como son consejos que te dan, o sea, y para...
Not at all. Splints are devices you put on a limb, maybe, or in a finger or some articulation in
sorry, I
order
read
to
it
limit.
bad. Yes, I read it advices. Oh my God, sorry. Yes, devices son las prótesis que te pones, ¿verdad? Son como los aparatos.
Férulas.
Yes,
Exactly.
yes.
Exactly. So don't forget about that. Okay, thank you. And aid could be a help. Okay. Like ayuda. Aid, to aid movement. Okay. So I think we are done here. Or you have any more questions? Maybe here. Club foot or talipes. I don't know if you heard about pie equinovaro.
Yes.
Okay, that's the meaning of club foot. Okay. It is called talipes too in English. Do you have any questions?
No, miss. It's okay.
Perfect. Opticians. Opticians test eyesight and prescribe glasses, also known as sparkles. and contact lenses when necessary. The examination includes measuring intraoral pressure, the pressure of fluid inside the eye, an examination, the retina. If the physician suspects an eye disease, such as glaucoma, they refer the patient to their GP for treatment. The GP may then refer to the patient for treatment to an ophthalmologist, okay? A doctor. What is an ophthalmologist? A doctor who specializes in diseases of the eye. So we have two kinds of specializations here. An opticians, that are those ones. And in Spanish, it's called optometrista. And the ophthalmologist, that is the specialist, the main specialist for eye diseases. Okay, I'm sorry, here is E, not A. Is it understood?
Miss, GP is a general physician.
General, yeah, that's right.
Okay.
I think this is clear.
Yes.
Perfect. Hospitals. An introduction. Outpatients are the people who come to a hospital to attend a clinic or to have tests or treatment and then return home on the same day. Inpatients stay in the hospital for 1 or more days. The rooms where they stay are called wards, or look, what we said before, salas, wards, okay? If patients' treatment requires only 1 day, such as simple operation, they can be admitted to the day surgery unit. So is it understood here? We have the outpatients and the inpatients. Okay? Inpatients, not impatient. Okay? So outpatients are the people who come to the hospital to attend a clinic or to have tests or treatment and then return home on the same day. And the inpatients stay in the hospital. Is there any question here?
No, teacher.
Perfect. Outpatients, the accident and emergency department, here we have these letters to represent this, also called casualty, is where patients who are acutely ill with a sudden serious condition that come for assessment and treatment. Outpatients who have an appointment to see the specialist go to a clinic in one of the outpatients department. We have these letters to represent this. They have usually been referred to the hospital by the GP, general physician, okay, who writes a referral letter to the consultant explaining the patient's problem. So here, what he does is make a reference to another person who can attend them. Do you understand? Do you have any questions here for vocabulary?
Acutely means like in Spanish, presuntamente
Very sick.
enfermos. Very sick.
Very sick, very ill.
Okay.
Muy enfermo. Okay. Sudden. Do you understand the word sudden? Hello?
De repente.
Yeah.
Más o menos.
Yeah, that's good. Okay, I don't know what else. I think you understand the whole words. Or you have any questions here?
No, miss.
Okay, you understand referral letter, right?
Yes.
Can you say it in Spanish, please?
Ok, cuando refieres a un paciente a otro especialista.
Excelente. Carta de referencia. That's
Sí.
good. Perfect. Inpatients. I don't know what time it is. Oh, I think we're gonna continue tomorrow. Okay. Yes, we have 4 more slides. Okay. I'm sorry. Okay, so it was a lot of information, right? But we're gonna continue I don't know, not Monday, not Thursday, maybe Wednesday, I think, is the next class from now. Tomorrow we have the speaking class, of course, but Wednesday will be the next class with slides, okay? So tomorrow, who's going to be first? Hello? Please try to decide while you are filling this for me. Who wants to be at 6?
You miss.
Okay, Vania is going to be the first one. And then 6:15, who's going to be 6:15?
I can be 6:15.
Okay. Okay. And Ale, you're going to be 6:30. It's okay?
It's okay, miss.
Perfect. Thank you very much. So see you tomorrow. Have a
Miss,
Bye,
nice
miss.
night. Bye. Take care. I'm sorry.
what was the homework, miss?
We wanted to find out some word. Who can help me with that, please? I forgot the
It was
normatron, midwifery, right? That was
right.
our homework. Okay, tomorrow we're gonna talk about that. Bye. Thank you.
Bye, miss. Thank
Bye.
you.
Take care.